Pregnancy is an incredible journey, filled with wonder and anticipation. As an expectant mother, you become acutely aware of every tiny flutter and movement within your womb. One such sensation that often piques curiosity is fetal hiccups. These rhythmic twitches can feel like gentle pulsations or even a slight bouncing sensation. Rest assured, fetal hiccups are incredibly common and, in most cases, perfectly normal. They are a natural part of your baby's development and nothing to be alarmed about. Think of them as a sign that your little one is growing and thriving inside you. These hiccups typically begin in the second trimester, around week 24, and may continue into the third trimester. However, some mothers-to-be start feeling them even earlier. The exact timing can vary from pregnancy to pregnancy, and there's no need for concern if you experience them earlier or later than others. Remember, each pregnancy is unique, and your experience will be just as individual as your little one growing inside you. Enjoy these moments of connection with your baby, knowing that fetal hiccups are a reassuring sign of their well-being. You might be wondering what exactly causes these adorable hiccups in your unborn baby. While we can't ask our little ones directly, medical experts have uncovered some fascinating insights into the biological processes at play. Fetal hiccups are believed to be caused by the involuntary contraction of the diaphragm, the dome-shaped muscle that separates the chest from the abdomen. This is the same muscle responsible for hiccups in adults. In the womb, this diaphragm contraction is often accompanied by the intake of amniotic fluid, which helps your baby's lungs develop and mature. This process is thought to be a crucial part of preparing your baby's respiratory system for life outside the womb. By practicing these breathing-like movements, your little one is strengthening their diaphragm and preparing their lungs to take their first breaths of air. So, the next time you feel those rhythmic twitches, remember that they are not only completely normal, but also a sign that your baby's respiratory system is developing just as it should. Every pregnancy is different, and so is the frequency of fetal hiccups. There's no magic number or set schedule. You might notice these hiccups several times a day, or you might only experience them a few times a week. The duration of these hiccup episodes can also vary greatly. Sometimes they last for a few minutes, while other times they might persist for 20 to 30 minutes. Again, this is perfectly normal and nothing to be concerned about. As you move through your pregnancy, you may even begin to notice certain patterns. Perhaps your baby gets the hiccups after a meal or before bedtime. These patterns are unique to your baby and can offer a fascinating glimpse into their developing routines. The key takeaway is that there's a wide range of what's considered normal when it comes to fetal hiccup frequency and duration. Trust your instincts, and if something feels off or you have any concerns, don't hesitate to reach out to your healthcare provider. When to seek guidance. Recognizing potential concerns. While fetal hiccups are typically harmless, there are a few instances where they might warrant a conversation with your doctor. It's always better to err on the side of caution and seek professional guidance if you notice anything unusual. If you experience prolonged episodes of fetal hiccups lasting for more than an hour, particularly in the third trimester, it's important to contact your healthcare provider. Additionally, if you notice a sudden decrease or cessation of fetal movement, along with the absence of hiccups, it's crucial to seek medical attention promptly. These signs could potentially indicate an underlying issue, and your doctor can perform necessary tests to ensure everything is okay. Remember, your healthcare provider is your partner in this journey, and they are there to address any concerns and provide you with peace of mind. Your baby's language. Tracking movements and finding reassurance. As an expectant mother, you develop an intuitive connection with your baby. One of the most remarkable ways this bond is strengthened is through feeling your baby move. These movements, including those adorable hiccups, are your baby's way of communicating with you. To gain a deeper understanding of your baby's patterns, consider keeping a simple movement log. Note the times you feel your baby hiccup, kick, or roll. You might start to recognize predictable patterns, which can be incredibly reassuring. Remember, every baby is different, and there's no need to compare your experiences to others. What matters most is establishing a sense of normalcy for your pregnancy. If you ever feel uncertain or have any anxieties, don't hesitate to reach out to your doctor. They are there to support you every step of the way.